Hi there. I am Dr. Syed Amir Jazairi from University of Malaya Center of Addiction Sciences. In a significant change of policy, the Malaysian government now has authority for providing medical treatment for heroin dependence and related health conditions. Evidence shows that treating addiction and drug abuse with such medications as methadone or etc. could help to decrease the unusually high prevalence of HIV in Malaysia. Despite consistent economic development and a respected primary health care system, Malaysia has the second highest HIV prevalence among adults in the Western Pacific region and the highest proportion of HIV cases resulting from injection drug abuse. By the end of 2004, as many as 234,000 heroin abusers had been registered in the official Malaysian government registry, but there may be as many as 500,000 heroin abusers there. Drug abuse and related disorders, such as HIV, exert a heavy burden on the country's healthcare and legal systems. Historically, Malaysian drug offenders were rehabilitated involuntarily in correctional rather than healthcare facilities. This approach had limited effectiveness, which led to the recent introduction of medical treatment for addiction. University of Malaya Center of Addiction Sciences, or briefly UMCAS, was officially launched on April 2009. Its objectives are many, but primarily UMCAS aspires to be the main research center in Malaysia related to the field of addiction, eventually providing better care to those managing the care of addicts, leading to better quality of life for those affected with addictions. National and international experts has come together in this center to help people and to lead them to the better quality of life. Here, please allow me to introduce my colleagues to you. Associate Professor Dr. Ahmad Hatim bin Suleiman. He is the head of the Department of Psychological Medicine at the moment. Professor Dr. Muhammad Hussein bin Habil. He is the head of University of Malaya Center of Addiction Sciences. He is an addiction specialist and consultant psychiatrist at the Department of Psychological Medicine, University of Malaya, Kuala Lumpur, Malaysia. Professor Dr. Rahima bint Abdul Qadir is a professor and a senior consultant for clinical preventive dentistry and dental public health at University of Kebanggasa in Malaysia. Dr. Rusti Abd Rashid, he is a medical lecturer and he is a coordinator of University of Malaya Center of Addiction Sciences. And myself, Dr. Syed Amir Jazairi. I am a psychologist and now I am working in University of Malaya Center of Addiction Sciences as a postdoctoral research fellow. I am working on psychotherapy with addicts and try to help them psychologically to overcome their problems. Dr. Muhammad Mohsen Ahmad Zahari is a medical lecturer and researcher. At the moment, he is leading our research in prisons and closed environments. Dr. Amr Siddiq bin Amr Nurdin, senior lecturer in Department of Psychological Medicine, Faculty of Medicine, University of Malaya. And others are Associate Professor Dr. Jasit Singh Gill, He is an expert psychiatrist in areas of psychosexuality and early psychosis. Dr. Isa Abdul Rahim is currently a trainee lecturer under the Department of Psychological Medicine, Faculty of Medicine, University of Malaya. She has a special interest in nicotine addiction and started publishing papers in addiction field. Dr. Nurul Asikin Yahya is the head of Dental Public Health Department, Faculty of Dentistry and University Kebanggasa in Malaysia. Associate Professor Dr. Noor Zoraini Binti Muhammad Haris Robson. She is the first addiction medicine specialist in Malaysia. She is currently practicing in Department of Primary Care Medicine, Faculty of Medicine, University of Malaya in Malaysia. To make you familiar with our services and duties, I can mention to these tables. Our clinical services are including heroin addiction treatment services, smoking cessation treatment services, central nervous system depressants, prison and forensic services, HIV/AIDS treatment services, addiction and mental health in primary care services, etc. Our scientific studies are drug substitution therapy studies, methadone, and others. We are collaborating and working with some organizations in Malaysia. I can mention through the following lines. Pilot methadone maintenance treatment program in Malaysian prisons, collaborating with Center of Excellence for Research in AIDS. Pilot methadone maintenance treatment program in AADK Aftercare Center. Collaboration with National Anti-Drug Agency. Addiction intervention program in Malaysian mosques. Alcohol intervention program among Malaysian Aborigines. Early intervention program in schools. Mobile harm reduction services. Hospital-based smoking sessions program collaborating with RUKA. Our technology and innovations, which I can mention, are management protocols and models for various substance dependence treatment, national methadone maintenance treatment guidelines and standard operating procedures, collaboration with Ministry of Health, standard operating procedure for prison methadone maintenance treatment, collaborating with Prison Department, Ministry of Health, and Malaysian AIDS Council. Planned rating scales, translation and validation studies in addiction field in Malaysia. Discovery of new drugs for addiction treatment. And here are some of our training programs for undergraduate and postgraduate students in master degree, PhD degrees, for NGOs. And finally, general practitioner associations. As you can see, the national and international experts have come together finally to defeat the drug addiction in Malaysia. In next videos, I will share more information about us to you. See you there. Bye for now.